So it is the most common form of arthritis and the most common disease of the joints. Okay, this is osteoarthritis. 10 million of us suffer from osteoarthritis of the knee specifically. And most of the people who have osteoarthritis are older. Okay, older than age 45, although that's not entirely true nowadays because younger people are getting it, mostly because we as Americans are getting more and more obese, which is one of the biggest risk factors for developing osteoarthritis of the knee. As we get bigger, our joints fail earlier. Okay, and that's why it's becoming a disease that's now affecting younger and younger people. Okay. Women are much more commonly affected than men with osteoarthritis of the knee specifically. There's other forms of arthritis. These aren't what we're going to talk about. We're talking about osteoarthritis. Okay? There's rheumatoid arthritis. That's a picture of a rheumatoid hand. Okay? It's a very crippling, deforming disease. There's post-traumatic arthritis, meaning the result of a fracture or a fall or a trauma or a car accident. That can result in the development of arthritis. Avascular necrosis. We talked about bone necrosis of the jaw. Basically, that's a type of arthritis that occurs when segments and pieces of bone die. It's very common in the hip, actually. Infectious arthritis, as a result of an infection, it can destroy and damage a joint. Gout does that same thing. It can really damage the joint. Polymyalgia rheumatica and spondyloarthropathies. Polymyalgia rheumatica is a muscular disease that affects the hip joints and the muscles of the hips and the shoulders. Okay? Spondyloarthropathies are things like Reiter's disease, ankylosing spondylitis. Okay? They're inflammatory diseases that attack the spine and the joints. Okay? Basically, what is arthritis? It's the erosion, destruction, damage, or just flat out wear and tear of your tread, the tread on your tires, the cartilage that covers the bones of your hips, the bones of your knees, the bones of your wrists. Okay? Anything that damages that tread, that protective cushion, that process is called arthritis. Okay? When it's the wear and tear related kind, we call that osteoarthritis. Okay? So osteoarthritis is like wearing out tread on a tire. That's my best analogy. The more miles you put on it, the faster the tread wears out. Okay? That's osteoarthritis. That's much more common than any of those other rare forms of arthritis. Okay? So what are the symptoms? We probably all know these. Okay? And there's probably not someone in this. There's no one in this room who's probably hadn't been affected by arthritis in one form or another. Pain is the most common. It's usually activity-related pain in the earliest stages, meaning you go for a walk, you get done, my knee hurts. Or you climb a flight of stairs and your hip hurts. Okay? Activity-related pain is by far the most common presenting symptom. Also stiffness. Okay? You sit too long in a chair, you go to get up, and your knee don't work. Like you got to straighten yourself up. It takes you 3 minutes to get going. You have an arthritic knee. Okay? That's true of the hip too. Okay, the hip tends to cause symptoms more in the front, in the groin, in the front of your thigh. Same thing. Go to get up and you can't straighten out because you get this kind of soreness right in your hip right here. Okay, that stiffness is a symptom of osteoarthritis. Okay, swelling is the most common thing, and everyone, there's a bunch of y'all who've had a knee replacement, so you know about this. When your joint, your knee, your hip, when it's swollen, it's warm. People kind of freak out about, my knee's warm. It's kind of even a little pink colored. That's inflammation. That's swelling in your knee. Okay, that's a symptom of inflammation and swelling in your knee or arthritis. Decreased range of motion or stiffness. Sometimes the joints don't work right. They catch, they click, they give out, they buckle. Something grabs either in your hip or your knee. Okay, that dysfunction is because things are damaged inside that joint. Okay, and that often results in a limp. Okay, there's two types of limps. There's more than two types of limps, but for me there's two types of limps because I do hips and knees. So there's a limp because your knee hurts, which is what we call an antalgic gait. Okay, so when your knee hurts, if it's your right knee, you just don't put full weight on it. So you do this and you try to get off it as fast as you can. Okay, so if your right knee hurts, you kind of do this number. Okay, so it's kind of a quick little whoop. Okay, and you're trying to not put as much weight on it. Now, all of y'all are going to be experts in knowing who needs to come see me for their hip, okay? Because this is what a hip limp looks like, okay? It's a waddling type of gait, all right? So if your right hip is the one that hurts and you're limping on it, you waddle over your right hip. So it looks like this. So if it's your right hip, you go. Or if it's both hips, you go like this. And you literally walk like a penguin. And you'll see it. You'll see your friend. You'll see your friend. You make sure you give them my card if they're walking like that. Okay? All right, so that's a hip limp. Okay? Now, the pain usually in its earliest stages is activity related. Okay? You do things, you pay for it. Okay? But when it gets bad, it hurts all the time. It hurts at rest, in your chair. It hurts at night. It wakes you up. Okay? That's when it's getting bad. Okay? That's when you need to see me. Okay? So what are the causes or risk factors? Well, excessive wear, just being too hard on your joints, having a hard occupation, heavy manual labor, being a professional football player, things like that. Joint injuries from sports and other high-impact activities. Marathon running, high association with knee problems. Okay, and age. So those are very common ones. Okay, and remember, most of the people over the age of 50 get arthritis of some form. Okay, but not everybody gets enough arthritis that they end up with a hip or a knee replacement, because there's things that you can do to prevent it. Obesity. This is one of the biggest factors that's affecting Americans today, and it's very common if you're significantly overweight to get arthritis in your knee. It's not quite as common in the hip, but there's a direct relationship between significantly overweight and wearing your knee out prematurely. Okay, so that's a big one. You can have some kind of congenital deformity. That's not too common, but it happens. We do see it. And there's accidents or work-related injuries and things that can cause accelerated damage in this arthritis process to start sooner. But in general, this is the concept, okay? You get osteoarthritis, that wear and tear arthritis, when the load you put on that tread exceeds the strength of the tread, okay? So, being overweight substantially accelerates the wear of your cartilage. In fact, every pound of weight loss that you do, or weight gain if you use the corollary, results in 3 pounds of stress reduction on the hip joint during normal walking. Okay? It's even higher for things like stair climbing, okay, and getting up out of a low chair. So what am I trying to say? So every pound of weight that you lose is 3 pounds of force reduction off of your hip during walking. Okay? So you lose 20 pounds, you lost a whole bunch of force on your hip. It makes a huge difference to the forces that your joints experience. Now that's just with walking. For the knee, it's 5 pounds during stair climbing. Okay, stairs are hard. Stairs put a lot of stress and strain on your joints. People who have a knee replacement, they can vouch for that. Stairs are one of the last things that they can do well because it requires so much force, so much power, so much strength. It takes 5 pounds more extra force to go up and down stairs. So every pound of weight you lose is like 5 pounds of force reduction on your knee during stair climbing. It's a humongous difference. So losing weight, losing even a few pounds makes sometimes extraordinary difference in your experience of pain, and it slows down the wear process. Okay? So what are your goals of managing your arthritis? Well, you want to alleviate the pain, and you want to prevent more damage to occur. You want to slow the deterioration. You want to get more mobile, improve your flexibility and range of motion. You want to improve your strength. You want to improve your function. You want to get off the cane and the walker, and you want to maximize your quality of life. So how do you do that? Okay, so there's lots of things. Okay, the last one, there's one on this list. There's one that's not even on this list. That's surgery. Right? I heard someone say that's not even on that list. Okay, that's the last thing. That's the last thing. Okay, there's so many more things you can do to try to deal with this osteoarthritis problem better. There's medications, so things like Aleve, ibuprofen. There's a list about this long of prescription versions of those medicines that reduce inflammation. Okay? There's vitamins, glucosamine, chondroitin sulfate. Don't spend a whole lot of money on those things because they haven't been scientifically proven to do anything. Although some of my patients swear by it. They say, man, I took that for 2 years. The moment I stopped it, my knee hurt like crazy. Okay? I have other people that I can't tell one bit from being on it. So my best solution about the vitamin thing, try it. Try it for 2 or 3 weeks. Take it every day. Stop it for a week. Take notes. If during those 3 weeks you were on it, you kind of were doing a little better. During that 1 week you were off it, you were a whole lot stiffer and sore, it's probably helping you. Okay? That's the only way you'll know. Okay? If you're no different, then don't waste your money. There's no good science behind it to support it. Okay? And it's not FDA regulated, so any company can say anything they want about these drugs. Whatever they want to say, they can say. Okay? Because it's not FDA regulated. So that's why you go to the GNC and there's like, there's a whole cabinet full of this stuff. Because there's 10 brands of everything. Okay? All right. Exercise, therapy, physical activity, by and large, the best thing that you can do, even if you have the earliest or even moderate stages of arthritis. That's the best thing. Well, maybe not the best thing, because losing those 20 pounds or 30 pounds probably would be even more effective because of how much force you get off your hips and knees. It's so critical. Okay. There's injections you can put in your knee. Intra-articular means inside the joint. Corticosteroid is like a steroid shot. Okay. My thumb is getting arthritis in it from how many steroid shots I give every day in clinic. Okay. It is by far the most common palliative type of treatment for arthritis. It's kind of a quick fix. It's a little Band-Aid you put on that thing. Okay. It's done to help you do the 2 things right above it. To exercise more, to lose weight, to slow this deterioration. Okay. Sometimes it takes a cortisone shot either in your hip and your knee to reduce the pain, reduce the inflammation. Not to undo the damage, just to reduce it. Okay. Joint fluid therapy. There's all different kinds of gels that you can put into your knee. People call them the rooster comb shots. Yeah. Doesn't make you cluck like a chicken. It just comes from rooster combs. Okay. And it's a series of injections. It's usually 3. There's one brand that you have to have 5 injections. But it's a gel you put into your knee. Okay. It just helps lubricate and cushion the knee. Sounds really cool. Just doesn't work that good. It's works for some people. It really does. But it's not the golden egg. Okay? It's not a cure. It doesn't magically refurbish anything. It's kind of like getting a cortisone shot. It's a Band-Aid. It doesn't undo things. Okay? And it sometimes doesn't even work as good as cortisone. Now there's also assisted devices. Okay? If anyone never had a hip that hurts, one of the best things you can do is get yourself a cane until the hip stops hurting. Okay? Because all you have to do if your left hip is hurting and you're doing that waddling thing over like this, you get a cane in your right hand opposite the side that hurts, and instead of waddling, you just lean off of that hip a little bit, and you can do a whole lot better. You just take a little pressure off your hip, and a lot of that soreness can become manageable. Now that's not obviously the solution. That's just another way of dealing with it until you can get the problem resolved. Okay? So don't be shy of a cane. I'd much rather you grab a cane than grab the curb because you fell. Okay? Because then you've lost. Then you have a hip fracture. Then you're on the operating table and you're never the same. Ever. Okay? Now, what are the surgical treatments of arthritis? Okay? This is what I did 4 times today. Okay? Hip and knee replacements. I did 2 hips and 2 knees today. So that's a picture of a hip replacement on the right, on the top. There's a front view and a side view. Basically, you take out the ball and socket and you put metal in its place. Okay? It's a metal prosthesis that you get put in your body to substitute for the rotten parts. Okay? It literally replaces those things. Your ligaments are still there, your tendons are still there, the tissues are still there. Just the bone and the arthritis and the spurs and the damaged cartilage get removed. Okay? So that's a hip replacement, and the bottom one is a knee replacement. These are both my own patients. Okay? Again, same deal. That shiny, bright, white looking stuff on the x-ray, that's the metal. Okay? You're substituting bony parts for metal parts. Okay? That replaces the joint. They're mechanical. They cure a lot of people, and I counted, I think, 6 or 7 people that have joint replacements in this room that I did. Okay, so it's unfortunate. That's what ends up happening when our joints really fail us. Okay. So, just like osteoporosis, exercise is critical for arthritis. Okay, if you just move more, you'll do better. Believe it or not. Okay, unless you're just so far gone. Usually, moving and being active is protective. Okay, it's vital to improvement of your symptoms, and regular activity is linked to all kinds of health benefits, which we've already heard about it. Increases your strength, endurance, flexibility, coordination, balance. All those things are so important. And it relieves pain. How? Well, just by moving, you get that joint fluid stirred up in your knee, so it actually literally lubricates the joint. Okay? So more fluid circulates throughout your knee, so it's less stiff. Okay? It also stimulates nerve endings that just aren't the pain ones. When you're just sitting there, the pain is going throb, toothache. But by moving, you stimulate proprioceptors, other nerves around those joints, the knees and the hips. And it takes the focus off the pain. Okay? So it's very important to improving your arthritic symptoms. Weight-bearing exercise is actually scientifically proven to promote healthy cartilage. It's one of the biggest misconceptions I talk about in clinic. People think, well, I'm afraid to exercise, right? You tell me that's wear and tear, so if I do more wear and tear, doesn't that make it worse? Well, not exactly. Okay? Certain kind of exercise is harmful, like jogging and sprinting and that kind of thing. But regular weight-bearing exercise, the motion and the weight-bearing together makes the cartilage cells healthier. It makes their glucosaminoglycans and their little molecules, it makes them produce them better. It makes them more robust. It actually makes cartilage happier. Okay? What we see when we do surgery on knees, when we scope knees, for example, we see a period of time after a knee scope where the cartilage, just from washing the joint fluid out and being a little inactive for 2 weeks, recover from knee scope, the cartilage softens. It just gets softer. Just from that, 2 things, washing the fluid out and being inactive. And so we don't let people return from a simple outpatient surgery like a knee scope for a month, because that's how long it takes for you to get back active, get the normal joint fluid back into the knee to make the cartilage robust, firm, and strong again. About a month. Okay? So inactivity softens cartilage, weight-bearing activity promotes healthy cartilage. Now, if there's not any sliver of healthy cartilage left in your knee because it's shot, then you probably need a knee replacement. But if you still have some good cartilage, moving, being active, doing weight-bearing exercise, taking some anti-inflammatories, getting a cortisone shot, that's going to keep you going, and it may slow this deterioration and slow the symptoms down a lot. So how do you exercise when your joints hurt? Well, if you do too much, like we just talked about, you're going to aggravate things. Make it sore, make it inflamed, make it warm, make it irritated. And it just hurts. Okay, so you can't do too much. It's easy to do too much. Just ask some of my folks who've had a knee replacement. If you exercise too little, or if you don't do anything, your range of motion suffers, you get really stiff, the cartilage softens, and the pain gets worse. Okay, so it's moderation. You got to do things in moderation. All right. Also, doing things low impact is key. So you do exercise in moderation 3 times a week. You do low impact stuff like swimming, water aerobics, stationary bike, elliptical, treadmill, yoga. Okay? These are the things that are going to keep you young, keep your joints young, keep your cartilage healthy. Okay? And then doing resistance training with low weights and lots of reps. You don't want to be bench pressing 3,000 pounds. Okay? You want to do low weight, high reps. That's the best thing that you can do to promote a healthy joint. Okay? If you're doing leg extensions, leg presses, it's low weight, high rep. Okay? Oops, wrong one. We're almost done. And of course, you could dance too, yes. That's a good exercise. Trust me, that's a really good exercise. So, I'm about done talking. So in conclusion, optimizing your bone health is critical to maintaining a good quality of life and good functional independence as we age. Okay? The keys are regular exercise in moderation, low impact, good nutrition. You identify the problems that you have and you get treatment for them if you have osteoporosis or osteoarthritis particularly. You maintain a low body weight. Get some of those pounds off. It's critical. Okay? And you got to protect those hips. I tell you, you break your hip, life changes forever. You got to get your bone health good so that you don't have a broken hip, because it changes your life, the rest of your life. Okay? I think that's it. Thank you very much.